I'm Dr. Amy Kanata.
And I'm Ashley Baratko.
And we're from Phoenix Spine and Joint. Today's video is going to be talking about what to expect the first week after your total knee replacement. I'm Dr. Amy.
And I'm Ashley.
And we're going to get you back in the game. So there are three goals that we want you focused on the first week after your total knee replacement. The first is to be able to ambulate or walk 25 to 100 feet with assistance. Usually most patients leave the center with a walker. You may be provided with a walker, crutches, or a cane, but you should be able to work your way up to 100 feet. The second, I'll let Ashley talk about.
The second one is going to be trying to regain 80 degrees of range of motion in that knee. That's going to be best done sitting and standing out of a chair. So when you're getting up to do that walking, try and sit down for a little bit, bend that knee, and then stand back up, along with some of the exercises that we're going to show you today should also help with that 80 degrees of motion.
Last but not least is regaining extension of your knee. Now the goal here is to regain, we call it negative, because the actual knee, when you actually straighten it out, it actually goes past 0 degrees. So we want to work on that extension to minus 10 degrees, which sounds like a pretty lofty goal, but it's good to focus on your goals and then you know what you're working towards so that you can track your own progress. So next, we're going to show you exactly what those exercises are, how often you should do them, and how long to do them for. The most important thing after knee replacement right off the bat is regaining your flexion, which is how much your knee bends, and the extension of your knee, how much your knee extends out after knee surgery. So the first exercise, you're going to want to sit comfortably on the chair with your back nice and straight. On Ashley, we're going to use her right knee to demonstrate the proper positioning of this exercise. So she's got her right knee just sort of comfortable. You're going to want to make sure that your foot is flat on the floor, make sure it's pretty well cemented down. And then what you're going to do is you're going to scoot forward on the chair to increase that flexion angle. The first week after surgery, we would like to see your knee get to 90 degrees of flexion. Basically, that's almost a 90-degree angle. So what you're going to want to do with this exercise, if the better that you get, you're going to want to put your foot back towards your bum and then slide forward to really increase that flexion angle of your knee. You're going to want to hold it for 2 minutes. Now you may notice that when you do this exercise, it is going to be painful at first. That's normal because your body's healing, it's swollen, and there's a lot of inflammation as it heals. You're going to have to push yourself to the point of pain and a little bit past. Between this exercise and the other exercise we're going to show you, you can do this exercise up to 2 hours per day. So you're going to want to hold it for 2 minutes, then let your knee relax. Maybe stretch it out even, get some blood flowing, and then you're going to want to do it for another 2 minutes. So you can do that as many times throughout the day, up to 2 hours. The next exercise that we're going to show you for week 1 post-op recovery for your total knee replacement is extension. Extension of your knee is your ability to straighten your knee out. And it's really important to your biomechanics of your knee function and making sure you regain your full range of motion after surgery, being able to extend your knee all the way so that you don't have permanent flexion like that. For this exercise, when you first start out after your knee replacement, you're going to need 2 chairs. You're going to want to keep your toes kind of pointing up towards the ceiling. Make sure that you don't have any external or internal rotation of your hip. Keep your leg nice and straight, your toes pointing directly up. You will notice right after surgery that you will have a slight flexion to your knee. It will be difficult to extend your knee right after surgery because of the swelling that's going on inside the joint itself. So what you're going to want to do sitting in the chair is to try to straighten your leg out and extend your knee all the way down as much as you can towards the floor. Now, you are going to experience pain with this one. You're going to have to work your way through it. It will get better, but initially the first week of surgery, you are going to experience some pain, and that's okay. So again, you're going to want to hold this. You're going to want to hold the extended position for 2 minutes. All right, so just to recap, these are some things that you want to watch out for the first week after your total knee replacement, and call your surgeon immediately if you notice any of these signs.
Once again, we're looking for that fever of 100.4 and it's persistent over 24 hours, redness, swelling that's not going away with compression and elevation, numbness that's not going away with elevation, along with any sort of bleeding or drainage coming from that incision site.
Thanks so much. We hope you enjoyed this video.